Epilepsy is not the end.
The cells that carry the messages from into your brain and spinal cord are called neurons. When you touch something, sensory neurons in your PNS pick up that information and carry the electrical signal called a nerve impulse up to your spinal cord and brain. Yes, Jessica. I was walking to school and saw my friend fall down on the ground and started shaking, his teeth clenched, and he seemed unfocused. Then after he stopped moving, he fainted. What happened to him? Your friend had a seizure. It is the result of a sudden imbalance in the brain's electrical system, causing neurons to fire in an excessive and synchronized way, which temporarily disrupts normal brain function and may cause the jerking movement you saw. I have surprise for you next class. I hope you are excited. So class, today we have Dr. Dark to tell us more about epilepsy.
Hello everyone, I hope you are well and excited to know more about epilepsy. Epilepsy is a neurological disorder that causes recurrent seizures due to abnormal electrical activity in the brain. Symptoms of seizures can include sudden loss of consciousness, convulsions and involuntary movements like tremors, sudden stiffening or relaxation of the body, involuntary urination during the seizure, loss of awareness or concentration such as staring into space and being unresponsive, and strange sensations like smelling unfamiliar odors, numbness, or changes in vision.
Doctor, is there different types of epilepsy?
Yes, there's focal epilepsy. A seizure can occur while the person remains conscious. During these seizures, they might be able to speak and remember what happened, though they may experience abnormal movements. A seizure can also occur accompanied by a loss of awareness or consciousness of their surroundings, confusion, and an inability to respond to questions for a few minutes. There is generalized epilepsy, which can cause loss of consciousness and involuntary muscle movements. Muscles may stiffen, relax, twitch, convulse, or shake. Sometimes, a combination of these movements occurs within the same seizure. Its most famous types are tonic-clonic seizures, which begin with muscle stiffening, the tonic phase, followed by rhythmic jerking movements, the clonic phase. These usually last for a few minutes, after which the person feels tired or confused. It can also manifest as brief, sudden seizures involving loss of consciousness or attention, often going unnoticed. Symptoms of these include staring into space without responding, rapid blinking of the eyes, and automatic movements such as chewing or rubbing the hands together.
Doctor, what should we do if a family member had a seizure?
First thing to do when a seizure happens for the first time is to film the seizure and to go to a neurologist so they can diagnose the condition and prescribe the necessary medication. Also, to write down in a notebook the date of any future seizures, exactly when they happen, how long they last, and if possible, to have someone with them film the seizures when they occur. The person should avoid bright lights and loud noises. We must keep in mind that non-drug treatments do not replace medication, but rather help it by reducing the number and severity of seizures. So, alongside medication, we follow non-drug treatments such as the keto diet, listening to music, practicing yoga and meditation, which reduce stress and anxiety and help regulate breathing, posture, and balance, and reduce seizures caused by anxiety, practicing aerobic exercises, herbal therapy.
What is the keto diet?
The ketogenic diet consists of a high fat percentage and low carbohydrates. The ratio is typically 4 parts fat to 1 part carbohydrates and proteins combined. Actually, there was a child younger than 6 years old who came to my clinic, and I advised his mother to fry his food in oil instead of grilling or boiling, and did not prescribe any medication for him, and the child started school without experiencing any seizures. The ketogenic diet completely stops seizures in 16% of cases, especially in children. So it is very possible to stop or at least reduce the amount of medications taken just by changing the diet.
That is great.
Indeed it is. We follow the ketogenic diet because it helps reduce seizures, especially if the patient does not like medication and its side effects. Improvement and reduction in seizures typically begin to appear within 3-4 months. Despite the many benefits of the ketogenic diet, it still has side effects, including stomach pain, constipation, dehydration, lethargy and loss of energy, low blood sugar levels, vomiting, weight loss. Listening to classical music, such as the music of the composer Mozart, helps in treating some types of epilepsy, such as Lennox-Gastaut syndrome, drug-resistant epilepsy in children, benign epilepsy, refractory status epilepticus, and refractory elastic seizures, which is called laughing seizures. Throughout the history, many great figures had epilepsy, as Julius Caesar, Napoleon Bonaparte, Michelangelo, Alfred Nobel, George Frederick Handel. So, having epilepsy did not prevent these men from achieving great things that many others did not, so we must remember that epilepsy is not the end.
Thank you so much.